Hi, I'm Dr. Janine Johnson. I'm a chiropractic physician. In my 23 years of clinical practice, I've seen thousands of patients with chronic health conditions. Autoimmune conditions like fibromyalgia, chronic fatigue syndrome, Hashimoto's thyroiditis, peripheral neuropathy, type 2 diabetes, chronic neck and back pain, leg pain, migraine headaches, to name a few. Many of these patients would reach a plateau in their care, would see improvement, but only they get to a point they just weren't getting better beyond that point. Some of them were so unstable that they needed to be seen 1 to 2 times a week on a regular basis just to keep them functioning. That was until I introduced brain-based therapies and metabolic solutions. I was introduced to this work by Dr. Frederick Carrick. He's a board-certified chiropractic neurologist and founder of the Carrick Institute, as well as Dr. Michael L. Johnson, who's also a board-certified chiropractic neurologist and author of the book, What Do You Do When the Medications Don't Work? A non-drug approach to fibromyalgia, migraine headaches, and other chronic conditions. I knew that we had to take a unique approach with these patients, that we had to look at the whole patient, not just looking at the disease or the label and basing what we do for them based on what their disease or label was. The approach is called functional neurology and metabolic solutions. Instead of looking at the patient under one microscope, we're going to look at the patient under multiple microscopes. Now, the doctors have learned the body in chapters. We have a tendency to look at the patient under one microscope, that microscope being whatever our specialty is. So it might be I'm looking at neck and back pain for the cause of their problem. Or if you're going with a stomach problem, I'm going to give you stomach medication. Or you go to a doctor for headaches, we're going to give you the headache medication. Instead of looking at the whole picture to find out why are you having this problem and trying to address your physiology based on that. Now what we do is, again, this is functional neurology and metabolic solutions. We look by way of testing. We do extensive blood testing and other testing. We find what's normal and leave alone, and we find what's abnormal, and we fix it by stimulating specific pathways using dietary changes and bionutritional supplementation. We challenge the status quo by not just doing the standard lab test, by doing different tests. Now, this testing's been around for quite a while. It's just that it's not conventionally done because it's not covered by insurance. So some of the testing that we do comprehensive blood work. What I typically see when I ask someone to bring in their blood work is I see what's called a Chem 12. That means they're looking at 12 different markers in their blood work. When we order blood work, we order what's called a Chem 55. We're looking at 55 different markers in your blood to assess what's happening with your physiology and your biochemistry. We also order a complete metabolic panel, a lipid panel, an immune panel. There's 2 parts to your immune system, Th1 and Th2, and they should be relatively in balance. If they're not, we want to find out why. We're going to do a thyroid panel. We're going to look at your thyroid. Now, typically, the only thing that's ordered with the thyroid is TSH, thyroid stimulating hormone. But there are other markers that can be looked at to assess what's happening with the thyroid. The reason it's not assessed differently, other than the thyroid stimulating hormone, is because it doesn't change how you're going to be treated. So what I mean is, what's going to happen conventionally is they're going to look at the thyroid stimulating hormone level. If it's not within a normal range, they're going to medicate you. They're going to give you medication, maybe Synthroid, to try to bring that thyroid stimulating hormone within a certain range. Once it's within that range, the treatment is successful and you're done, regardless of how you feel or regardless of the cause. And unfortunately, 83% of people with thyroid problems still have thyroid symptoms even on medication. We're going to look at your cortisol levels. Your adrenal glands, which sit above your kidneys, release cortisol, and that's a stress handling hormone. Now, we're designed to be stressed out and then go on vacation. But because of our lifestyle, our diet, we're under stress all the time. Our cortisol rhythms can be thrown off. So we can assess that throughout the day and see what your cortisol rhythm is. We can also test you for food sensitivities. And when I say food sensitivities, I'm not talking about food that just gives you a little GI distress. You can be sensitive to gluten, which is a wheat found in protein, milk, soy, egg, and yeast. And when you have a sensitivity or an intolerance to these foods, it can cause an autoimmune response. What that means is when you eat those foods, your immune system goes on attack, starts attacking your own body. That's a serious thing. We can also, with this testing, it's a stool sample, so they can also test you for the gene, so it's DNA, to see if you are a carrier of the gene that makes you sensitive to gluten. We can check your gut function. We can check you for parasites or bacteria. We can check you for leaky gut. And leaky gut is when the barrier in your gut is broken down from the standard American diet, caffeine, high carbs, too much sugar, smoking, antibiotics, those things that cause stress can break down that barrier. So foods that get in, that normally don't get into your bloodstream, particles, viruses, bacteria can now get in there. And that again causes an autoimmune response. We look in areas where your prior doctors have not even considered. We also perform a neurological test. We can assess you functionally. We can check your brain and nervous system, see how they're functioning without the use of MRI or needles. So by developing a recovery plan that treats you, the person, not the label, you can get your life back. If the treatments, the medications, the things you've been doing on your own worked, you would not be listening to this video right now. You wouldn't be a patient in my office. If you're the type of person that likes to take control of their life and of their health, then I'm the doctor for you. What I would recommend you do now is to call my office, 231-882-5533. Ask for the free report and DVD. And if there is a condition, a specific condition that you're interested in, please let my staff know and we'll get you that condition-specific information to you. We also have in-office seminars. So if you want more information, you can register yourself for those seminars. Seating is limited, so if you want to attend, you need to register in advance. The other thing that you can do is you can schedule for 2 free visits to see, and I can see if you're a candidate for this type of care, to see if I can accept you into this program of care. If you schedule for the 2 free visits, what I would want you to do is to, on a seriousness scale of 0 to 10, 10 being the most serious, you need to be at a 7 or 8. You need to be, you've been to several doctors, you're kind of just tired of what you've been doing, you don't want to keep doing the same thing over and over and getting the same results. If that's you, and you're a person that wants to take control of your life and your health, then please call my office for the 2 free visits. Thank you. I'm Dr. Janine Johnson.